What I'm about to show you may completely change the way you look at every blood pressure number you've ever written down at home. And if you've ever felt relieved by a normal reading or terrified by a high one, there's something you need to know before you trust either. Because one of the biggest myths in heart health is that blood pressure is a fixed number, like your age or your shoe size. It isn't. It's a moving target. Before we begin, please subscribe to this channel so you never miss life-saving heart advice that could protect you daily. I'm Dr. Aliza Wright, and today I need to show you why a single blood pressure reading can lie to you so convincingly that it changes treatment, triggers panic, or hides real danger. Right now, somewhere, a senior is staring at a monitor that says 172/96 and thinking, this is it, something terrible is happening. Their heart starts racing, their hands shake, and that fear alone pushes the number even higher. And at the very same time, someone else is seeing 124/78 and feeling safe, reassured, almost proud, not realizing that number doesn't reflect what their blood pressure is doing during the rest of the day, during stress, during activity, during sleep, during the hours that actually predict stroke and heart attack risk. That's what makes this so dangerous. Blood pressure can be truthful, but it can also be deeply misleading. And if you don't understand the difference, you can make the wrong decision with total confidence. Here's the truth. And this is the one idea I need you to lock into your mind before this video ends. Your real blood pressure is not one number. It is a pattern across time, across conditions, across repeated measurements taken the right way. If you don't know the pattern, that number on the screen might be noise. It might be a stress reaction. It might be a posture problem. It might be a timing issue. It might be medication wearing off. It might be a falsely comforting average hiding dangerous spikes. That is why I titled this video exactly the way I did. Don't trust your blood pressure until you know this, because this is the difference between a snapshot and the truth. And medicine should never be built on a snapshot alone. Let me tell you about Eleanor, because her story captures the problem perfectly. Eleanor was 72, disciplined, careful, the kind of person who never missed a medication and never ignored a symptom. One morning she woke up late, realized she had forgotten to call her daughter the night before, rushed downstairs, fed the dog, climbed back up, sat on the edge of her bed, rapped on the cuff, and pressed start. The reading came back 181/102. She froze. She was convinced she was heading toward a stroke. She called her son crying. He called 911. By the time paramedics arrived, sat her down, let her rest, and repeated the measurement properly. Her pressure had fallen dramatically. Not because the danger magically vanished, but because the first number was never a true resting number to begin with. That's the part people miss. And it matters more than almost anything else. Blood pressure responds to movement, urgency, noise, fear, temperature, conversation, even anticipation. When you rush, your body doesn't care that you plan to take a medical reading in 60 seconds. Your nervous system is still activated. Adrenaline is still circulating. Your heart is still pumping harder. Your vessels are still adjusting. So the monitor gives you a real number, yes, but it is real only for that stressed moment. It is not automatically your baseline. It is not automatically the number your doctor should treat. It is not automatically the number that defines you. And this is where so many people go wrong. They confuse an event with a diagnosis. They confuse a spike with a pattern. They confuse fear with certainty. Now, let me show you the opposite scenario because this one is even more unsettling. Samuel was 76, and every time he went to his doctor's office, his blood pressure looked acceptable. Not perfect, but acceptable. 128/80, 132/82. Numbers that didn't raise alarm. He left those visits feeling safe. But at home, he was waking with pounding headaches. In the evenings, he felt pressure behind his eyes. His wife noticed he became flushed and irritable late in the day. When he finally started checking at home, correctly and consistently, his evening readings were often in the 160s. Office looked normal. Home was high. He had what we call masked hypertension. And masked hypertension is one of the most dangerous reasons not to trust a single good reading. Most people have heard of white coat hypertension, where the pressure climbs in the doctor's office because anxiety, rushing, unfamiliar surroundings, and anticipation all push it upward. But masked hypertension is the mirror image, and in many ways it's more dangerous because it hides in plain sight. In that situation, the office number looks normal, while your real-life numbers are elevated when no one is watching. At home, in the evening, during your routine, during the hours your arteries are actually living through. So, when people ask me, "Doctor, which number is the real one, the office one, or the home one?" my answer is always the same. Neither by itself. The truth comes from the pattern. The truth comes when you compare properly measured numbers over time and look for consistency. And there's another layer to this, because even when you do everything mostly right, the first reading is often not the reading I trust most. Let me tell you about Gloria, 69, who used to take one reading every morning and build her entire mood around it. If it was good, she had a good day. If it was high, she had a bad one. But when I asked her to take 3 readings, 1 minute apart, something remarkable happened. The first would be 148 over 88. The second, 137 over 82. The third, 131 over 79. Same chair, same arm, same cuff, same person, just a few minutes apart. Which one was the truth? Not the first by itself. The first was often her transition number, the number her body gave before it fully settled into the measurement process. That's why in proper home monitoring, we care so much about repeat readings. Blood pressure is not a statue. It is a living, shifting signal. The first number may reflect lingering tension, anticipation, a slight posture adjustment, even the stress of hearing the cuff begin to tighten. But when you take 2 or 3 measurements and look at what happens next, you begin to see whether that first number was an outlier or part of a stable trend. This is also why one frightening reading should almost never define your emotional state. It deserves attention, yes. It deserves context, absolutely, but it does not deserve blind trust. A second and third reading often tell a more honest story than the first one ever could. That alone has saved many people from unnecessary panic. Your blood pressure follows rhythms, and your body is not designed to sit at one exact number all day. It usually changes with waking, eating, medication timing, activity, stress, bladder fullness, pain, and fatigue. That is normal physiology. So if you check at random times, you may mistake normal variation for disease progression. Or worse, you may miss a real pattern because the random readings blur it. For most people, the most useful home readings are taken at consistent times, often in the morning before medication and breakfast, and again in the evening before dinner, unless your physician has given you a different plan. Consistency doesn't just make your log look cleaner. It makes your numbers interpretable. And interpretable numbers are the only numbers that can actually help you. Everything else is just digital clutter. Let me tell you about Rose, because her problem had nothing to do with disease progression and everything to do with routine. Rose was 71 and had started watching a cable news program every morning while taking her pressure. She liked to feel informed. She also liked a strong cup of coffee, which she finished right before putting on the cuff. Some mornings, she delayed using the bathroom because she didn't want to miss the opening headlines. Then, she'd sit there, jaw tight, shoulders lifted, listening to upsetting stories, bladder full, caffeine rising, and she'd wonder why her blood pressure was suddenly out of control. Her medications got adjusted twice based on those numbers, but the real culprit wasn't a failing heart. It was the environment she had built around the measurement itself. She was testing stress, caffeine, and urgency, not resting blood pressure. I want you to hear this clearly, because it's one of the simplest corrections and one of the most powerful. If you want a meaningful reading, you have to respect the setup. No caffeine right before, no smoking, no exercise, empty your bladder. Sit quietly for 5 full minutes. No television, no phone conversation, no upsetting headlines, no folding laundry with one hand while the cuff inflates. Create a quiet, neutral moment and let your body settle. I know that sounds almost too simple, but medicine often lives in simple things done consistently. And when you skip that calm setup, you may add 10, 15, even more points without realizing it. Then you don't just get a wrong number. You get a wrong impression of your risk. And wrong impressions have consequences, especially when treatment decisions follow them. Now, Let's go deeper, because even with perfect timing and a calm room, technique can still betray you. Arthur, 78, could not understand why his home readings were always lower than the readings in the clinic. He thought his doctor's machine was wrong. He thought maybe the office staff was rushing. Then I asked him to show me exactly how he measured at home. He sat in a recliner, leaned back, held his arm slightly above chest level with no support, and placed the cuff over a light long-sleeve undershirt because, as he put it, it's thin, so it shouldn't matter. But it did matter. The unsupported arm, the raised position, the layer of fabric, all of it was distorting the result. He wasn't measuring his blood pressure. He was measuring a preventable technical error dressed up like medical certainty. This is where people get fooled, because the monitor still gives a number. If it flashed error every time the arm was in the wrong place or the cuff sat over clothing, far fewer people would be misled. But it doesn't. It gives you something precise looking, and precision is seductive. It makes us think the result must be trustworthy. Yet if the cuff is too high above heart level, the reading can look falsely low. If the arm hangs too low, the reading can look falsely high. If the arm isn't supported, your muscles tense, and the number can climb. If the cuff is over clothing, the signal is disturbed. The solution is boring but essential. Bare upper arm, cuff at heart level, arm supported, body relaxed, feet flat, back supported, no talking, no movement. That is how trustworthy numbers begin. Then there's cuff size. And this is one of the most underappreciated issues in home monitoring. Linda was 67, slender, small-framed, and using the standard cuff that came in the box. For 2 years, her readings looked high enough to justify increasing medication. But she felt weak, dizzy, washed out, especially when standing. When we checked her in the office with a cuff that actually fit her arm size, her numbers were dramatically lower. Her home cuff was wrong for her arm, and it had been feeding her frightening, misleading readings for months. On the other side of the spectrum, a cuff that's too small can push numbers falsely high, and a cuff that's too large can distort readings in the opposite direction. So before you trust the screen, trust the fit. If the cuff doesn't match the arm, the number loses credibility. That's why I tell patients not to shop for home monitors the way they shop for a toaster. Convenience matters, yes, but validation and fit matter more. Choose an automatic upper arm monitor, not a finger monitor, and be cautious with wrist monitors unless a clinician has specifically guided you there. Make sure the cuff matches the circumference of your upper arm. If you are unsure, bring the device to your appointment and compare it with office measurements. That one step can prevent months or years of confusion. Because home monitoring is incredibly helpful when it's done right. It can reveal white coat hypertension. It can uncover masked hypertension. It can show whether treatment is working. But it is only powerful when the device and the technique deserve your confidence. Otherwise, you are building a medical story on a shaky foundation. Let me show you another way people get misled, because this one is subtle. Martin, 73, proudly told me he had good blood pressure most of the time. I asked to see his numbers. He had no log, just memory. He remembered the good ones because they made him feel safe. He remembered the scary ones because they made him anxious. He forgot the middle. He forgot the dates. He forgot whether he took them before medication or after dinner or after climbing stairs. In his mind, he had a blood pressure history. On paper, he had nothing. And that's important because the human brain is terrible at remembering medical patterns objectively. We remember emotion, not sequence. We remember surprises, not averages. We remember the number that scared us, not the 40 that quietly came before it. That is why a written log is not optional. A log turns panic into information, and information into decisions. Once Martin started recording date, time, first reading, second reading, and any unusual circumstance, the truth appeared quickly. His pressure wasn't randomly dangerous. It was predictably higher in the evenings on days he skipped his afternoon walk and ate very salty frozen meals. That's actionable. That's useful. That's the kind of thing you and your physician can work with. But without the log, all he had was a feeling. And feelings can be sincere while still being medically unhelpful. This is what I mean when I say don't trust your blood pressure until you know this. You need the conditions, the pattern, and the record. Without those three pieces, you may be reacting to fragments. With them, you begin to see the real behavior of your cardiovascular system. Now, I want to tell you about something that surprises many people the first time they hear it. Sometimes the arm you choose matters. Patricia, 75, had always used her left arm because it felt easier. Her readings were usually fine. During one visit, a nurse measured both arms and noticed a significant difference. The right arm was consistently higher. That prompted further evaluation. Thankfully, it was caught before a major event happened. The point is not that every arm difference means something catastrophic. Many people have a small difference, and that can be completely normal. But when you first begin monitoring at home, it's wise to compare both arms, and after that, use the arm that consistently reads higher, especially if your clinician agrees. Otherwise, you may be reassuring yourself with the lower side while the more informative side goes ignored. And that brings us to one of the most important mindset shifts in this whole conversation. A blood pressure reading is not a verdict. It is a clue. One clue. Valuable? Yes. Sometimes urgent? Absolutely. But still a clue. If you see a high number once after stress, movement, coffee, pain, or anxiety, it does not automatically mean your blood pressure is out of control. And if you see a good number once, it does not automatically mean all is well. Numbers need context, numbers need repetition, numbers need comparison. In medicine, we make mistakes when we fall in love with a single data point because it is dramatic, convenient, or emotionally satisfying. The body is more complex than that. Your arteries are telling a story over time. If you interrupt that story and stare only at one sentence, you may misunderstand the plot entirely. But I also need to be careful here, because I never want "don't trust one reading" to sound like ignore a dangerous reading. Those are not the same thing. If you get a very high number, repeat it after resting properly. If it stays severely elevated, especially if it's above 180 over 120, and you have symptoms like chest pain, shortness of breath, weakness, numbness, trouble speaking, severe headache, or vision changes, that is not the moment for curiosity. That is the moment for immediate medical attention. So yes, one reading should not cause blind panic, but one reading with severe symptoms should never be brushed aside either. Wisdom in blood pressure monitoring is not about dismissing numbers. It's about placing them in the right category: routine pattern, technical error, temporary spike, or true emergency. That distinction can protect your life. So what does a trustworthy blood pressure routine actually look like? If you want numbers that mean something, let me give you the protocol I wish every patient learned on day one. First, choose consistency over convenience. Measure at the same times each day whenever possible, often morning and evening. Second, create the right setup. Empty your bladder. Avoid caffeine, exercise, and smoking beforehand. Sit somewhere quiet. Third, uncover the arm completely. No rolled sleeves pressing into the arm, no thin shirt under the cuff, no close enough, bare skin. Fourth, sit with your back supported, feet flat on the floor, legs uncrossed. Rest the arm on a surface so the cuff is at heart level. Fifth, be silent. Don't talk. Don't watch upsetting television. Let your nervous system settle before you ask it a question. Then, once you're in position, wait 5 full minutes, not 30 seconds. Not "I'm already sitting, so that counts." 5 quiet minutes. After that, take a reading. Wait about a minute. Take a second reading. If your doctor wants 3, take 3. Record them all. Do not cherry pick the prettiest number. Do not erase the first because it embarrassed you. Do not keep only the scariest because it validates your fear. Record the sequence honestly. Over several days, that sequence becomes more valuable than any single number ever could. And if the readings remain confusing, if office and home don't match, if symptoms don't line up, that is when ambulatory monitoring or a careful clinician review becomes incredibly helpful. The answer to uncertainty is not guessing. The answer is better measurement and better pattern recognition. Here is the part almost nobody tells patients, and maybe they should. Your blood pressure monitor is not there to give you emotional comfort. It is there to give you information. Those are not always the same thing. Sometimes the number comforts you. Sometimes it unsettles you, but the purpose of measuring is not to feel better in the moment. The purpose is to understand what your blood pressure is actually doing so you can make wise choices over time. When people start using the monitor as a reassurance machine, they often fall into a trap. They check too often, under bad conditions, after every worry, after every salty meal, after every headache, and the data gets noisier and the anxiety gets louder. A good monitoring routine should reduce confusion, not feed it. If it's feeding anxiety, the system needs to be corrected. And there's one more truth hidden inside this title that I don't want you to miss. Sometimes people say, my blood pressure's fine at home, so I'm okay, or my blood pressure is always high at the doctor, so they're overreacting. Maybe, but maybe not. Home numbers can be wrong if the technique is wrong. Office numbers can be misleading if the circumstance is unusual. That is why the real goal is not to choose one location and declare it the winner. The goal is to compare good quality readings from different settings and see whether they tell the same story. When they do, confidence rises. When they don't, curiosity should rise. That difference between settings is not an inconvenience. It is often the most important clue in the whole case. Blood pressure becomes meaningful not when it is easy, but when it is consistent. So if I had to compress this whole video into one sentence, it would be this. Never trust a blood pressure number until you know how it was taken, when it was taken, and whether it fits the larger pattern. That is the key. How, when pattern. If one of those is missing, caution is warranted. If all three are clear, then the number begins to earn your trust. This is why some people get overtreated. It's why others get falsely reassured. It's why home monitoring can save lives, and why sloppy monitoring can mislead lives. The monitor itself is not the villain. The misunderstanding is, we assume that because a machine displays a number, that number must be the truth. But the truth in medicine is almost always more demanding than that. It asks for context. It asks for repetition. It asks for discipline. Now, let me give you a practical example, because examples make this real. Suppose you wake up, use the bathroom, sit quietly, avoid coffee, support your arm properly, and take 2 readings 1 minute apart before breakfast and before medication. Then you repeat that routine in the evening for 7 days. You log everything honestly. At the end of the week, your average readings are consistently elevated. That pattern deserves attention. That pattern has weight. On the other hand, if you get one alarming number after climbing stairs with groceries, talking on the phone, cuff over clothing, right after coffee, and then never repeat it correctly, that number may deserve caution, but not immediate belief. The difference between those two scenarios is not luck. It is method. Good method turns numbers into knowledge. Poor method turns them into noise. I've seen lives changed in both directions, and that is why I feel so strongly about this. I have seen people placed on medications they likely didn't need because their home technique created falsely high readings day after day. I have also seen people delay treatment because a few comforting readings convinced them everything was normal when their true pattern said otherwise. Both are harmful, both are preventable, and both begin with the same misunderstanding, believing that blood pressure is a single number rather than a behavior your body reveals over time. When you understand that, everything changes. You stop chasing random digits. You stop worshiping one good number. You stop spiraling over one bad one. Instead, you begin observing your blood pressure the way a clinician does, as a pattern, a context, a signal with conditions attached. Let me bring back Eleanor for a moment, because her story didn't end with that terrifying morning. After the ambulance scare, she could have done what many people do and decided never to trust home monitoring again. But instead, she learned the correct routine. For 2 weeks, she measured quietly, consistently, and wrote everything down. Her numbers were not perfect, but they were far lower and far more stable than that first emergency reading had suggested. Her doctor adjusted her care based on the pattern, not the panic. That changed everything. She no longer lived at the mercy of a single screen flash. She understood what she was seeing. And understanding is powerful. It turns fear into action. It turns confusion into strategy. It turns a scary machine on the nightstand into a tool that actually serves your health instead of controlling your emotions. And Samuel, the man with normal office readings but high home readings, changed too. Once we had consistent data, we could see that his blood pressure problem wasn't imaginary and it wasn't occasional. It was being missed because it showed up in the setting that mattered most, his ordinary life. That's the value of good home monitoring. Not endless monitoring, good monitoring. Structured, calm, repeatable, trustworthy. Without that, his condition might have stayed hidden much longer. With it, he got the treatment he needed before the consequences got worse. That is why I never dismiss home readings, and I never blindly accept them either. They must be earned. They must be measured correctly. They must fit a pattern. When they do, they are some of the most useful numbers in all of cardiovascular medicine. So here is what I want you to remember tonight. The next time you sit down with that cuff around your arm, don't ask, is this number good or bad? Not first. Ask, did I earn the right to trust this number? Was I rested? Was I calm? Was the cuff on bare skin? Was my arm supported at heart level? Did I avoid caffeine, urgency, and distraction? Did I take more than one reading? Did I write it down? Does it match the pattern I've been seeing? Or is it an outlier? Those questions are not overthinking. They are what separate useful home monitoring from dangerous guesswork. And once you start asking them, you'll never look at a blood pressure reading the same way again. You'll see it for what it truly is. A clue that only becomes truth when context unlocks it. If this video helped you, I want you to do two things. First, subscribe, because this channel exists to give you practical, life-protecting information in plain language you can actually use. Second, share this with someone who checks their blood pressure at home, especially a parent, a spouse, or a friend who gets frightened by one number or falsely reassured by another. They may be one simple protocol away from seeing the truth more clearly. Your blood pressure matters, your heart matters, but most of all, the way you measure matters. Don't trust your blood pressure until you know this. The number is never the whole story. The pattern is. Learn the pattern, respect the process, and you'll make better decisions with your doctor and live with far more confidence. Take care of yourself, and I'll see you in the next video.